Welcome to the ONC Health IT Certification Program Developer Roundtable session. My name is Jennifer Gilson with Kaufman Associates and will be assisting with the logistical support for the Zoom session. We ask that you select the speaker view option located at the top right side of your Zoom interface. This will allow you to see the speakers they present or share information. If you need technical assistance during the session, please type the issue into the chat box and one of our techs will respond to you. At the bottom of the Zoom screen, you will see the Q&A box. We encourage you to use this feature to submit questions at any point during the meeting. Please be aware that today's session is being recorded. Closed captioning is available by clicking the CC icon at the button at the bottom of your screen, and all phone and computer lines have been muted. I will now turn it over to Rob.
Thank you. Welcome, everybody. Thank you for joining us for what is the last Develop Roundtable of the year. We will pick up again in the new year in February or March, but this is the last one this year. Hard as it is to believe, we are actually closing in on the end of 2022. For us at ONC, and I think for all of you, that means that there are a number of Cures update requirements that people will be attending to. There's obviously updates to US CDI, for many developers to the Firebase API, and then there are a number of other different standards and criteria updates. I did want to emphasize for folks, we're going to go through some of those things and those requirements today as a refresh. But if you have not yet connected with your ACB, your certification body, to schedule updating your current certificates, you're going to want to do that as soon as possible. We know for a fact that their queues and their scheduling are pretty filled at the moment, but you want to try and resolve that before the end of the year. We don't want anyone to end up in a non-conformity situation relative to the Cures update requirements. There is one additional deadline this year, which most of you are aware of. There is the second round of real-world testing plans that need to be available in the Certified Health IT product list, the Chapel, by December 15th. But today is the due date for many of the ACBs in submitting your plans and informations for their review. So again, if you haven't been in touch with your ACB about this second round of real-world testing plan, you want to get in touch with them immediately so that you can try to work to resolve any issues before that 12/15 requirement. So we have a packed schedule today to talk about a number of things. Next slide. We will be talking about the 2022 requirements. We'll be talking a little bit about real-world testing. We'll be talking a little bit about G10, and we'll talk some more about where Inferno is headed in the future. I'm going to turn it over to our branch chief of program administration, Tony Myers, and he's going to get us kicked off.
Great, thanks, Rob. Excuse me. Welcome, everyone. Good afternoon. So I'm going to run through, since Rob just mentioned we're coming up to the end of the year, some deadlines we need to meet, and so I want to go through and discuss the 2022 requirements. Next slide, please. So as many of you know, the 2015 edition Cures update was, the purpose of it was to provide transparency, introduce modern standards, and enhance health IT capabilities. It also included several new revised and removed criteria. So we're going to place a link that you'll have access to shortly if it's not already there. There are actually going to be 3 links. One is to the 2015 Cures update criteria. There you can click on the certification companion guides or CCGs. They provide clarifications, regulatory text, lots of information. The second link is to the Cures update fact sheet. It's actually entitled 2015 edition Cures update, what it means for certified health IT developers. This takes what I'm discussing now and it gives a little bit more detail around the criteria updates and some of the conditions. And then finally, program resources, where you can find a wealth of resources about real world testing, conformance, standards, lots of fact sheets. You can review, we didn't put a link in there, but if you go to healthit.gov, there are a number of blogs we have written recently. So Um, on this slide, you'll see there's sort of categories of updates, and some of these categories include a single criteria, and some of them include multiple criteria. But most of these new revised 2015 Cures update criteria have to be included in certified health ID developers products and provided to its customers by December 31st. The only exception there is with real world testing, which is due to December 15th. And as Rob just mentioned, many of the ACBs have internal deadlines of today. So those plans are in the works now. Sarah Clark from the Program Administration branch is going to go into more detail about real world testing plans. So I'm just going to briefly touch on it and then go through the criteria updates. Next slide, please. So real world testing, any of the health IT modules certified to any of the criteria listed in 45 CFR 170-405A. Asara has a slide on all this criteria for your reference, but they have to have their 2023, the developers have to have their 2023 real world testing plans approved by their ACB and also made publicly available on certified health IT product list by December 15th. So again, a lot of those internal deadlines are coming up or today. So a lot of that is in the works, and as far as going to go into more detail. Again, here's some links to provide. Excuse me, you'll see those under program resources, which was the I think the third link that we provided. So next slide, please. So I'm going to talk a little bit about the standardized API for patient and population services. Scott Bahone of the Tools and Testing branch is going to later on in the presentation go through some clarifications and inquiries we received. But I'll just sort of cover it. This is a new criteria, and so it does require testing through an authorized testing lab. And the standard, the G10 certification criteria requires that health IT developers provide standardized access to single patient and multiple patient services via an API using the HL7 FHIR. So the requirement here is that developers previously certified to G8 must provide their customers with health IT modules that are now certified to G10. So why is this important? Well, for developers, it can integrate a wide array of functionalities into their products, make available standardized data routinely available for access, exchange, and use. And on the provider side, it can efficiently transmit electronic health information amongst health IT systems and to their patients. And then finally, for the patients, they can efficiently access their electronic health information using API technology where and how they want. So again, for all of these I'm going through, there is a certification companion guide. You can, if you have any questions about process related to these updates, you can talk to your ACB. And we also have the healthit.gov inquiry portal where you're welcome to submit questions as well. Next slide, please. Electronic prescribing. So this refers to the B3 criteria. The use of health IT developers certified to B3, this particular criterion must update and now support the National Council for Prescription Drug Programs, or NCPDP script version 201.7071 standard by December 31st. And this new standard for electronic prescribing equips certified health IT modules with the ability to reliably transmit medication orders. And as a result, the healthcare providers can utilize certified health IT to transmit prescriptions to their patients and their pharmacies securely and accurately. So why are these important? Well, on the provider side, it can utilize to, as I just stated, efficiently transmit prescriptions to their patients' pharmacies. And on the patient side, they can receive their prescriptions in a timely manner, and importantly, less prone to transmission errors. Next slide, please. Okay, USCDI, Consolidated Clinical Document Architecture, CCDA Companion Guide. The USCDI is a standardized set of health data classes and constituent data elements that replaces the Common Clinical Data Set, or CCDS. And this enhances nationwide interoperability, health information exchange, and includes a number of new data classes and elements such as provenance, clinical nodes, pediatric vital signs, address, email, phone. The CCDA Companion Guide also supports USCDI version 1, and subsequent versions so that healthcare providers can efficiently transmit CCDA documents among different health IT systems and other entities like um, public health agencies. So for this requirement, the health IT developers currently certified to affected 2015 edition criteria must provide their customers with updated versions of their projects that support USCDI by December 31st. You'll see here a number of criteria. Developers currently certified to those criteria that I just pointed to on the screen here, 2015 edition criteria have until December 1st or 31st, excuse me, to provide their customers with updated versions of their products that support USCDI and or CCDA standards, again, by December 31st. So why is this important? Well, developers can more easily exchange, use, and leverage USCDI and CCDA data received from other developers, and this dramatically improves interoperability. And on the provider side, they can consistently and routinely transmit USCDI and CCDA data elements across all certified health IT for patient care. And then finally, patients can more reliably access their EHI or electronic health information and leverage plug and play applications using USCDI. Next slide, please. All right, clinical quality measures. The 2015, all right, excuse me, health IT developers, the revised C3 criteria, excuse me, removes HL7 quality reporting document architecture standards requirements, and it replaces it with the health IT modules to support the CMS QRDA implementation guides. So for this particular one, this particular criteria, developers of affected certified health IT must have their updated certified health IT products available to their customers by December 31st. And so why is this important? Well, for developers, they'll face less burden in their certification process by removing certification requirements that don't support quality reporting for CMS programs. And then providers will now be able to utilize CMS specific implementation guides for CMS program reporting. Next slide. Okay, and ASTM updates, these are 3 criteria. They relate to D2, D3, D10. So any health IT developer certified to those particular criteria prior to May 2020 must have their updated certified products available to their customers by December 31st. And the importance here is that for developers, they can use the most up-to-date ATSM specifications for audit and disclosure logs. Providers can create audit logs for specific time periods and sort entries into the audit log by a standardized set of up-to-date and relevant data elements. And then patients finally can be more confident in the security of their information as the up-to-date standards equate to better tracking that improves patient safety. Next slide. And then the 2 last areas, privacy and security authentication and updates support security tags. These refer to the criteria D12, D13, D7, D8. For the privacy and security authentication, certified IT developers have to certify to the following criteria by acknowledging or attesting yes or no to those particular criteria. And then for the support, the security tags, certified health IT developers may voluntarily update their modules certified to the following criteria to support security tagging at the documents, section, and entry levels. And that, again, the deadline is December 31st. So I know I kind of ran through that quickly, but these are the criteria updates that are, coming up at the end of the year, 2022, December 31st. Is the deadline for these. And if you have any questions about the process, about how to update these criteria, feel free to ask a question on the Health IT inquiry portal at healthit.gov or ask your authorized certification body or ACB. With that, I think I'm handing it over to Sarah Clark.
All right. Good afternoon, everyone. I'm Asara Clark. I'm going to talk about real-world testing today. As Tony mentioned, I live in the program administration branch and I'm lead for real-world testing, so happy to do a high-level overview of the real-world testing requirement. Next slide, please. All right, now first and foremost, we'll get into what is real-world testing. I think that everyone on this call is probably somewhat familiar with it, but we want to make sure that you understand the requirement fully. So real-world testing is a requirement for health IT developers to go out in a transparent way, assess the functionality of their certified health IT against the interoperability and data exchange criteria. So there are specific criteria that must be in the scope of your certification for you to be required to do real-world testing. But it's really transparency into the post-certification functionality. As you're all aware, to achieve and be granted certification by an ONC authorized certification body, you must undergo testing and or other evaluation techniques to demonstrate conformity to the requirements. But it's all done in a controlled environment, and that testing that would be required for interoperability and data exchange criteria is done with an ONC authorized testing laboratory in a controlled environment. And the purpose of real-world testing is to assess that functionality after it's been deployed and it's being used in real-world scenarios and use cases. So with, some products where you can go out on a shelf and pull a product just to kind of see if it still meets any of the requirements that it's being upheld to, you can't do that with health IT. So real-world testing is a way for us to be able to have some transparency into how the developer's product function in real-world scenarios. And so with that being said, the developer has full flexibility to determine their approaches for real-world testing based upon the care settings that, you market your health IT in and other elements that we'll touch on a little bit later on in this portion of the presentation. So it's really about testing the interoperability and data functionality in real-world environments. It verifies that it performs as intended by the certification criteria by allowing the developers to, determine their approaches on how they will conduct and measure their health IT systems in real-world scenarios. And these approaches are described in public and transparent ways through real-world testing plans and results reports that are also required, and I'll get into those a little bit more, that portion of the requirement a little bit more on the next slide. But however, real-world testing can be successfully described as this box here, where the certified health IT continues to be compliant with the certification criteria, including the required technical standards and vocabulary code sets. It also means that the certified health IT is exchanging electronic health information in care and practice settings for which it is marketed for use, and electronic health information is received and used in the certified health IT. Next slide, please. So when we talk about which health IT developers are required to conduct real-world testing, as I mentioned, and as Tony mentioned, there are specific data exchange and interoperability functionality that are called out in 17405A, where if you have any of those criteria within the scope of your certification, you must successfully test the real-world use of your health IT, your certified health IT. Now, I keep mentioning that this is all done in a transparent way for the public to have some insight into how developers are approaching this requirement. And this transparency is required by the maintenance of certification requirements that, roll up into this condition of certification, where health IT developers must submit a plan the year before they go out and execute it, so that they can discuss how they'll approach their real-world testing activities for the following year. And they're also required to report on those activities the year after they wrap up the execution of that particular plan. And they're going to have to report on those. And all of this is publicly transparent and posted on the Certified Health IT product list, so that the public can see into how the developer plans to approach real-world testing. But once they've executed that plan, we understand that, in real-world, application of anything, there may be changes, adjustments needed and everything. So we're looking for not only the results from the measurements that, were placed in the plan to, describe your approaches, but we're also looking for any changes that may have happened or any adjustments that you may have made during your real world testing activities to be included in your results reporting as well. And then as a maintenance and certification requirement, developers are also expected to, as in any other scenario, when maintaining your certifications to your health IT, is to self-report any nonconformities that may arise during your real-world testing activities. ONC, ACBs already have in place, processes to help bring any kind of self-reported nonconformities back into conformity with your certification requirements. And so you just want to treat it just like you would treat anything else by staying on top of, the functionality and the assurance that you're providing with the public and your clients for how your health IT functions in real world environments. Next slide, please. All right, so as Tony promised, here are the applicable real world testing criteria. I will not go through each of these criteria here, but just know that these are all of the data exchange and interoperability focused criteria. They have the care coordination, patient engagement, clinical quality measures, electronic exchange, application program interfaces, and public health criteria that will all are subject to real world testing. So if you have any of these criteria within the scope of your certification, you must conduct real world testing. So hopefully you have been, working with your ONC ACB as Rob drilled, home earlier on in the presentation. Next slide, please. All right, so just to talk a little bit about the deadlines to kind of recap on everything. I was talking a lot about the December 15th deadline for real world testing plans, but want to also share the deadlines for results reporting and for your health IT to have been certified in order for it to be, the deadline for certification to have been completed, and when those actual criteria need to be included in your real world testing plan. So this just gives a little bit of a timeline that shows you brings all those deadlines together. So I don't think we've mentioned just yet in the presentation, but I will go ahead and touch on that now. The August 31st deadline for certification to have been completed. So all health IT developers that have any of the eligible certification criteria within the scope of their certification, and if those certifications have been completed by or before August 31st of a given year, all of those health IT modules must be included in the plan that is due that year. And they must be addressed in your real world testing for the immediately following calendar year, okay? So we follow that on this. We're going to just flesh out what it looks like for, what health IT modules you'll include in your plan when you do the real world testing and when you will report on those real world testing activities. So I'd like to talk to where we sort of currently are in the process, where we're in 2022, and developers, you all should be executing and wrapping up the execution of your 2022 plan. However, that plan was due to your ONC ACB last year, the year before you're conducting the real world testing. So in 2021, you had to consider all certifications that were certified as of the August 31st deadline. That plan that you were creating to be made publicly available on the Certified Health IT product list by December 15th of last year, 2021, should have included every single health IT module that was certified as of August 31st of 2021. You're now in 2022 executing that plan. And then we're going to touch on the overlapping activities that you're, currently also doing for the next cycle of real world testing. But just to stick to these deadlines, you're executing your plan, you're developing your real world testing plan that is going to be due this December 15th on 2022, while you're wrapping up your 2022 plan. Okay, so let me back up and make sure that this is all making sense. You're executing your 2022 plan that was submitted to your ONC ACB last year in 2021. Okay, all those modules that were certified as of August 31st of 2021 were included in this year's plan, 2022's plan, even though that plan was due in 2021. So as you're wrapping up the execution of your 2022 plan, you're now in the season of submitting a new plan for your 2023 real-world testing activities that will be due this year on December 15th, the year before you're going to execute that plan. And then as you're getting into executing your 2023 plan in next year, you're going to have results that are going to be due on March the 15th of 2023 that are going to summarize all of your activities from this year's plan 2022. Okay, so there are lots of overlapping activities, but just to make sure that you're including the right modules, any modules that you have certified as of August 31st are to be included in the plan that is due that year and to be executed the immediately following year. Next slide, please. And on this slide, this just talks a little bit about the life cycle. We want to just make sure everyone knows that this is a yearly cycle where it has to be done on a yearly basis. So no matter whether you tested, you included your health IT modules in your last year's plan, if those modules are still certified as of the August 31st deadline the following year, they have to be included in your real world testing plan again. And there's no, I did it last year, I don't have to do it this year. As long as you have an active certification with any of these criteria included, you must do real world testing every single year. And so it occurs on a yearly cycle, but the planning, conducting, and reporting on the real world testing activities for a given year are going to overlap. And that's what this slide talks about here. I'm going to try to go through it pretty quickly, but it gives an example of two different certification dates for two different health IT modules and where they fall around that August 31st deadline and how they should be incorporated into your planning and activities. So in this example, we are going to go back to 2021, right, because we're still executing 2022 plans. And so as an example, if you're a health IT developer on the call, and say you had a health IT module with the applicable real world testing criteria that was certified, that completed certification in June of 2021. The August 31st, 2021 deadline comes around for you to include all the modules that were certified by then in that plan that's being developed for submission that current year, for execution the following year. Okay, and then after that August 31st deadline, then there was another certification that came about, module number 2, where the certification date falls after August 31st. It falls in October of 2021. Okay, so in this scenario, the module that should have been included in the 2022 real world testing plan that was due last year should have been module number 1. Module number 2 is not required to be included in real world testing plans until this current year's submission, which is going to be addressing 2023 real world testing activities, because it was not certified as of August 31st of 2021. It was not mandatory that the health IT developer included it in their 2022 plan. However, because it was certified as of August 21st, 2022, module number 2 is required to be included in the 2023 plan. All right. Now I'll note that if module number 1 is still certified, right, it still has an active certification as of August 31st of 2022, then module number 1 also goes into the 2023 plan that is due to your ONC ACB to be made publicly available December 15th of this year. Okay. So this is how these sort of overlapping activities will happen. As I mentioned before, you're executing your 2022 plan, you're planning for 2023 real world testing, so you're developing a new plan for next year. That's being submitted to your ONC ACB for public transparency and to be listed on Chapel by December 15th of this year. And as you're wrapping up your current 2022 plan that you submitted last year, you're going to be preparing results that are going to be due in March, no later, to be made publicly available no later than March 15th of next year, 2023. So lots of overlapping activity. I'll sort of stop that example there, but also want you to note that that March 15th plan for real world testing results reports to be made publicly available on Chapel will also have a separate deadline for your ONC ACB to be able to receive those plans and conduct completeness checks on them to make sure they're complete and have all the required elements that we outline in regulation. And so this is how every year real world testing will happen, is there'll be overlapping activities from one year to the next, and you'll be working on executing a plan while you're working on developing a new plan for the following year. And then as you're executing that new plan the following year, you'll be working on pulling together results from the previous year and the report on those, okay? So we just want to make sure that you don't miss out on any of these deadlines, that you understand how all of this works together fully. I'm going to go ahead and go to the next slide, and we'll talk a little bit about designing a real world testing plan. All right. Next slide, please. All right, now first and foremost, we have put out tons of resources to try to help you as developers organize all of this information. We want to be as helpful as possible in helping you, kind of pull this stuff together and make sure that it's done in a way that makes it, fairly seamless for the ONC ACB to determine completeness and such. So we have developed real world testing templates. The first I'm going to talk about here is the real world testing plan template, where this is an optional template. It's not mandatory that you use it, but it was something that ONC wanted to put out just to ensure that you had a way to sort of reference how this information could be organized. So what we do is we provide a section for each of the different fields that are required as far as elements that you must touch on in your real world testing plan. We provide like a little synopsis of what, should be included in that section. ONC ACBs may have other requirements for submission. This, again, is optional. We just want to make sure that you know that it's out there and that you're in touch with your ONC ACB on all submission requirements. Next slide, please. All right, and not to beat a dead horse, but just one more timeline that sort of talks about, all these different deadlines and the, when you conduct the real world testing, when you, report on the results and everything. So again, the August 31st deadline is for Health IT to have been certified. You're going to be describing, how you'll measure those specific Health IT modules in the following year in your plans that are to be submitted in the same year as those certifications have been completed. So this is another just layout of, the process being an ongoing yearly process that, you can refer back to these timelines just to make sure you're meeting all of the requirements for the different Health IT that you're managing certifications for. Next slide, please. All right, and on the included modules, this is an FAQ that we've received quite a bit. Folks are wanting to know, can they go above and beyond? If they do have certifications that have been, certified after the August 31st deadline, are they prohibited from including those in the very next year's real world testing activities? The answer to that is no. They're not prohibited from doing so. However, we just want to get to the, make sure that the basics are covered, that, Health IT developers must include the Health IT that is certified as of the August 31st deadline. That's the given rule. But certifications that happen or are granted after August 31st, can also be included in the immediately following year's real world testing activities. With that said, inclusion before the required, time frame or cycle that you're supposed to actually conduct the real world testing in does not excuse you from doing it the next year when it's actually required. So for developers who do choose to, conduct real world testing a year before it's actually due, based upon these certification dates, the expectation is that, that's great, but you still have to make sure you do it the year it's actually required. Again, every year, regardless of, whether last year, a certified Health IT module was eligible for real world testing, if it's still an active certification with the eligible or applicable criteria, you must do it every single year. I'll note the ICS Inherited Certified Status update. actually inherit the real world testing eligibility. So if you're not familiar with inherited certified status, it is a flexibility within the program where ONC allows the ONC ACB to use its discretion to grant certification without additional testing when the updates made to the certified health IT have not adversely impacted the certified functionality or capabilities. With that said, because of the nature of the flexibility being that it's really essentially the same product, just, been updated in a way that has not impacted the functionality, it's a way to reduce burden for the ACB to grant certification, without additional assessment when the changes that are being attested to have not or could not have adversely impacted the functionality. So for these cases where developers choose to utilize the inherited certified status flexibility to update their certified health IT, the real world testing requirement follows those newer versions because it is essentially the same product. So updates made after the August 31st deadline using inherited certified status flexibility actually will still be subject to real world testing the following year. We have more information on that in the resources that we have made available. I have gone, further into the inherited certified status scenario in other webinars. So I won't do a deep dive today, but that is the exception to the rule when it comes to certifications after the August 31st deadline is when using the inherited certified status flexibility. With that being said, I'll go ahead and move on to the next slide. All right, here are the real world testing plan elements that must be included in each of your plans. These are just all key elements that you're going to be touching on when you're fleshing out your approaches. So you have to touch on the testing methodologies that you're going to use. You have to have at least one. You're going to touch on any standards updates that you did for, that have been granted or that were updated by or before the August 31st deadline. You have to include those, and you have to demonstrate how you're going to go out and prove the functionality is there after those updates with real world testing. So you have to touch on those. Associated certification criteria, obviously, which one of the real world testing criteria are you addressing in your plan? The description of a measurement or metric used, that is, one that you have to describe and need at least one of. The care setting types that you market your health IT in, those must be covered in your real world testing plan. A justification for your approaches. Obviously, you're best suited to develop and, come up with the approaches most appropriate for your health IT and the care settings in which you market it in. And so we want to hear about, what made you choose the approaches that you chose based on some of those things, your expected outcomes, when you go into, your measurement approaches and your methodology approaches and your justifications and everything, what are the outcomes that you're expecting to see with your real world testing? Obviously, the goal is to demonstrate conformity to the criteria. So how are you going to do that? What outcomes are you looking for to demonstrate that your certified health IT remains conformant in real world scenarios and use cases when it's being used in the field? And then key real world testing milestones. And this is just like a timeline, guys. This is, what am I going to do and when am I going to do it? Who am I reaching out to? When is that going to happen? When am I going to conduct the observations? Whatever key milestones are within the steps that you're going to take in your real world testing process must be included as well. All right, next slide. Another key thing I wanted to touch on, I thought it'd be good for this forum, is to talk about the landing page recommendations that we have. So if you're not aware, developers must make past and current plans and results reports available via a URL on the Certified Health IT product list. The chapel allows for publication of one link for plans and one link for results reports. So with that being said, we highly recommend, to ensure continued access to current and previous year plans and results reports, that developers provide a single link that on the chapel that directs to a landing page with access to all of these documents. obviously for the first cycle of real world testing, we didn't necessarily need that. We noticed that some links went directly to a PDF, but just preparing the developer community to go into the next cycle of real world testing where you just don't have one plan to access, we encourage you to host a landing page so that you won't inadvertently miss a requirement to have all of your past plans accessible via the chapel. So, you have the option to include plans and results reports at the same link, or you could create 2 separate links, whatever is most appropriate for your circumstance, but the chapel will only allow for 1 link for results reports and 1 link for plans. And those should link to some type of landing page that provides access to current and previous plans that you have submitted and results reports that you have submitted. Next slide, please. All right, we're going to talk a little bit about post-plan submission considerations during testing and creation of your results report. Next slide, please. So as with the real-world testing plans, we also have a real-world testing results report template. It's a brand new template. We just try to make sure that coming up on the first year of having to submit results reports after wrapping up this first year of real-world testing, that it would be useful to have a results report template as well as a results report plan. So again, this is optional. It's not mandatory that you use it, but it helps to organize all of the information that should go into your plan. Again, ONC ACBs may have additional submission requirements, and so you want to confirm with them that you're meeting all of their submission requirements for results reports as well. Next slide, please. So when we're talking about results reporting, we do have some key elements as well that go into the results report. Some of them look the same as what goes into the plan. Others, have to do with sort of what happened when you conducted your real world testing. So these specific elements, I'm just going to touch on really briefly. I mentioned before changes to real world testing planned activities that occurred during the execution of your plan should be reported on. This is just to say, if you found that during your real world testing activities that the approaches that you thought would work don't work, the measurement that you thought would easily, demonstrate conformity just doesn't, or whatever approaches, you need to be adjusted or tweaked, you can do so. We do not require that those changes be reflected in an updated plan. We're not going to go back and change the plans that you put out and made public, but you can touch on those and should touch on those in your results reporting details, okay? So you're just going to talk about, the changes that were made, why you made the changes, and the impact on the intended outcomes of the testing, if applicable, okay? You're going to touch on the testing methods and methodologies that were used to demonstrate real-world interoperability and conformance to the full scope of the criteria. You're going to describe the care setting types that were tested for real-world interoperability. Any voluntary updates that, you did for, leveraging this standards version advancement process. You're going to, report on those and the assessment of newer standards that you may have, incorporated into the functionality. You're going to list your key milestones that were met and description of the outcome of real world testing, including any challenges that you may have encountered. This is all an opportunity for you to be fully transparent, for you to really shine and go above and beyond and just show your customers and the public, that you're on top of the functionality of your product and that you're concerned and you're interested in how it functions in the real world, because there's really no other assessment beyond a controlled testing environment. So taking real world testing seriously and reporting on those results and showing kind of, what kind of shiny, results you got is beneficial to each and every developer who takes it seriously and who really, gets out there and does it and goes above and beyond. And then lastly, the measurement and metric at least one associated with your real world testing activity. So these are some of the key elements that, you'll see fleshed out in the template, and you'll see in our resource guide that we've gone a little bit more in depth with as far as giving you some ideas on, what we mean by, or how to meet the required elements and make sure that you touch on them and address them appropriately in your plans and your results reports. Next slide, please. All right, so to wrap up, I'm just going to go over some resources. Tony went over them at a high level. I'm going to just go through them really quickly. Next slide, please. So I think you guys saw this same slide earlier on in the presentation, but we do have a fact sheet. I recommend taking a look at the fact sheet if you've never looked at the real world testing resource guide, just to kind of get a high level overview of real world testing, and then you go and do a deep dive into, you know, some of the scenarios and use cases and everything that, you know, we have incorporated just through learning from public inquiries, learning from, you know, even we go all the way back to, you know, the publication and of the final rule and what comments came in from the public. You know, we have started on kind of developing these resources really early on, incorporating all of, you know, the questions that we receive from the public, the questions that we receive from the ONC authorized certification bodies, and we just tried to put enough resources out there to make sure that everyone is successful here. But you have a fact sheet on what this all means for you as a health IT developer. I touched on the templates, but then you have a resource guide that we have recently updated this past summer. So there's a version 2 of that out, where the next slide I'm going to talk about what we added as far as, you know, additional clarifications. But the resource guide is a phenomenal way for you to really start to think about how to do all of this and put all of it together. We even include some sample scenarios in there as far as, like, you know, what a plan could look like for a health IT module with just one single criterion that is eligible for real world testing versus one that has multiple. So we put everything we could in there to help you guys out with meeting these requirements. We have a certification companion guide for real world testing, and we have recordings of all of the past public webinars that we have done on real world testing, as well as the presentations posted with them. And so those can all be found on the real world testing resource webpage. Next slide, please. All right, these are just some examples of what we included in the guide and some of what we got back from, you know, public comment and questions. So we have in there how to deal with resellers of your certified products, if any, if you use relied upon software or third-party software during the certification process, non-deployed capabilities or low adoption of capabilities. We talk about that in depth in the resource guide, and how to deal with cloud-based products. So those are all some of the special scenarios that you may be able to, that you will find in the resource guide, where we provide additional context. I also touch on these in more depth in all of the past real world testing webinars, public webinars. Next slide, please. All right, so just so you know, the resource guide goes in depth, aims to assist developers in organizing the elements alongside the templates. But we talk about all of the timeline requirements, details on plan elements needed. So the, you know, developing your real world testing plan goes way more in depth in the resource guide than we have time to go into here. Guidance on special considerations for unique products, and then sample scenarios to illustrate the creation of an actual real world testing plan. With this latest update, we also provided clarity on the inclusion of inherited certified products. I went over that a few slides ago. The importance of creating a landing page. That's today, I touched on it again. More examples on what to include in metrics, and then initial guidance on considerations for the creation of results reports. So again, we're just constantly, you know, putting things out there to help you guys devise these plans and, you know, collect the data and develop your results reports, and just, you know, improving your approaches from year to year for real world testing. Next slide. I think this might be it for me. All right, so I'm going to turn it over to Scott, and he's going to talk about G10.
All right, thank you. Hello, this is Scott Bohan from the ONC Tools and Testing branch. I'll be covering some inquiries and clarifications about the G10 standardized API criterion, as well as the API conditions and maintenance of certification requirements. In the interest of time, I'm going to be going through these inquiries quickly. If you are interested in more information regarding an inquiry or clarification that is presented, please submit a question in the Q&A feature of the webinar. All right, we can go to the next slide. Okay, so our first inquiry, what is the requirement regarding rollout of G10 certified APIs? So the API G10 rollout condition is that a certified API developer with certified API technology previously certified to the certification criterion in G8 must provide all API information sources with such certified API technology deployed with certified API technology certified to the G10 certification criterion by no later than December 31st, 2022. So for this maintenance of certification requirement, 12/31/2022 is the specific date for certified health IT developers by which API technology certified to G10 needs to be provided to the appropriate API information sources. And non-compliance with this requirement, ONC may initiate the direct review process to ensure compliance, or ONC could potentially terminate certifications and or issue bans if that issue is not corrected. We can go to the next slide. Okay, so this one is about US CDI and US Core must support requirements. So the inquiry is, what is the intent for requiring must support data elements from US Core when such elements are not explicitly specified in US CDI? And so the response here is that US Core may enforce stricter requirements than US CDI. Generally, it is not ONC's intent to override shall or must support standard requirements unless otherwise specifically stated, and all shall and must support elements in US Core must be supported even if not specified in the minimum required data elements in US CDI. Next slide, please. Okay, so this is an inquiry we received around native application. So what does native application mean and what will be tested for these? So from RFC 6749, a native application is a public client installed and executed on the device used by the resource owner. Protocol data and credentials are accessible to the resource owner. It is assumed that any client authentication credentials included in the application can be extracted. And on the other hand, dynamically issued credentials such as access tokens or refresh tokens can receive an acceptable level of protection. So certification testing requirements for native apps. First is the ability to grant a refresh token valid for a period of no less than 3 months to native applications capable of securing a refresh token, and publication of the methods by which secure issuance of an initial refresh token to native apps is supported according to the technical documentation requirements in G10 and the transparency conditions in the API maintenance of certification and conditions of certification requirements. And note that the Inferno testing tool does not include an automated test for this test step. Instead, the ONC ATL inspects the Health IT module and its documentation to verify the fulfillment of these requirements. Next slide, please. Okay, so an inquiry about API terms of use and product version. So the inquiry is there a requirement in the G10 documentation requirements for API terms of use to include a specific product and or version? And the response here is that there is not an explicit requirement in G10 for API terms of use to include a specific product or version. Next slide, please. All right, so an inquiry around US Core docref support. So the inquiry is, can you please clarify if the Health IT module needs to support the US Core docref operation? And the answer here is that the G10 certification criterion does not require support for the US Core docref operation. Next slide, please. Okay, this inquiry is around bulk data export for only specific patients. So for bulk data group export, is there a way for a client to restrict the data exported to only specific patients? Health IT developers may choose to implement the SVAP approved standard of bulk data access 2 instead of bulk data access 1.0.1. And bulk data access 2 defines an experimental and optional patient parameter for the group export operation, which restricts the returned resources to the patient compartments associated with the patients specified within the parameter. Next slide, please. Okay, so this is an inquiry around data absent reason and must support. So our server returns an observation resource for the Inferno pulse oximetry tests. The resource returned includes a data absent reason extension, and Inferno fails the test because of this. Can you please clarify why we are failing? So the data absent reason extension, data absent reason is an extension which provides a reason why the expected value or elements in the element that is extended are missing. In pulse oximetry tests, as in many of the other US core conformance tests, Inferno checks that a server implementation demonstrates that it supports the must support element in a meaningful way. Inferno must support tests check that each must support element is present in at least one resource from all resources returned from the server. It is not necessary that one resource contain all must support elements, and Inferno does not consider using a data absent reason extension on a must support element as supporting the element in a meaningful way. So Inferno ignores elements with data absent reason extensions when looking for must support elements. Next slide, please. So here's an inquiry around fire search responses. So for fire searches, our server provides relevant provenance resources in the response by default. However, our server fails Inferno test or Inferno search tests because these provenance resources are included in the response. The fire specification provides flexibility for the server to include other relevant resources in a fire server response or search response. So the Inferno ONC certification G10 standardized API test kit in version 2.2.2 released relaxes the constraint that prevented systems from returning additional resource types in search responses. Systems may return other resource types if they believe them to be relevant, and tests now provide informational messages in this case. Next slide, please. Okay, so here's a inquiry around bulk data scopes. So Inferno requires for bulk data access 1.0.1 scopes that information returned is no greater than scopes pre-authorized for multi-patient queries. Can you explain what this means? So as per the bulk data access 1.0.1 implementation guide, clients negotiate out of band the scopes which the client is authorized to access. Now, that is meaning that the developers of the client and the Health IT module pre-coordinate which scopes the client has access to on the Health IT module's bulk data fire server before using the bulk data access protocol. So for this test, the Health IT developers is attesting that its Health IT modules bulk data server only provides access to scopes which were negotiated out of band with the client. Next slide. Okay, so here's an inquiry around support for SVAP standards. So the inquiry is, does Inferno support the 2022 SVAP standards? And so the Inferno ONC certification G10 standardized API test kit supports the approved 2022 SVAP standards, and the test kit update added support for the following standards, including US Core 4 paired with US CDI version 1, US Core 5.0.1 paired with US CDI version 2, the Smart App Launch 2 implementation guide, and Bulk Data Access 2 implementation guide. Next slide, please. Okay, so this is an inquiry around using data absent reason to mask. So can developers use the FIRE data absent reason extension with code value of masked for observations deemed as restricted information, this being things like HIV lab results, behavioral health observations, and things of that nature? So Health IT developers are permitted to use the data absent reason extension to implement security and privacy mechanisms for their G10 certified modules. The Health IT developer and their Health IT module must continue to meet the requirements of the G10 criterion, as well as the API condition and maintenance of certification requirements. And the Health IT developer should be mindful to not take any action inconsistent with any other condition and maintenance of certification requirements, including the information blocking condition, assurances condition and maintenance requirements, and the communication condition and maintenance requirements. Next slide, please. So here's an inquiry around TLS enforcement. So can TLS be enforced at the application layer rather than the connection layer? So TLS version 1.2 or above must be enforced for the appropriate connections. There's a clarification that health IT developers are encouraged but not required to follow TLS best current practices for TLS version enforcement. And this recommends that TLS 1.2 or above be used for all production data exchange and limits support for lower versions of TLS. The ONC G10 Standardized API Test Kit version 3.2.0, in that version and above, TLS tests will now issue a warning for systems that accept TLS 1.0 or 1.1 connections instead of failing the system. For systems that do not deny TLS 1.0 or 1.1 connections, testers will be required to describe how they enforce use of TLS 1.2 or above in the Inferno test 9, 10, 15. TLS version 1.2 or above must be enforced. Next slide, please. So here's a clarification that was recently put out in the G10 CCG. This clarification being for subsequent connections of applications, or for subsequent connections of applications capable of storing a client secret, health IT modules are required to issue a refresh token valid for a new period of no shorter than 3 months per the API certification criterion requirement finalized in that reference. So this clarification is reiterating the existing requirement that on subsequent connections from an app, the health IT module must support issuance of a refresh token valid for a new period of no shorter than 3 months without requiring reauthentication and reauthorization when a valid refresh token is supplied. And an update to the Inferno ONC G10 Standardized API Test Kit is forthcoming to specifically address this requirement. Next slide, please. So here's another recently published clarification. For the purposes of testing and certification, health IT developers are not required to demonstrate health IT module support for the custodian data element in the document reference US Core 3.1.1 implementation guide profile. So the HL7 cross-group projects workgroup approved patching US Core 3.1.1 to remove must support from the document reference custodian data element. This update follows the US Core patch process, and the details for the patch can be found in the following JIRA ticket. And the Inferno ONC certification G10 Standardized API Test Kit version 3.1 or 3.3.0 implements this update. Next slide, please. Okay, so here is an inquiry around Smart App Launch, EHR launch. So for the purposes of certification testing, how can a health IT developer demonstrate that their health IT module supports a user launching an app from an EHR as part of the Smart App Launch EHR launch? So the G10 test procedure includes a step, AuthPat2, which tests that the health IT developer demonstrates the ability of the health IT module to initiate a launch sequence as per Smart App Launch Framework EHR launch. So, and as per the implementation guide, the start of the EHR launch sequence involves a user launching an app from an EHR session. So if the module being certified is an EHR, then the developer can demonstrate a user launching an app from their EHR session interface. However, some developers are interested in certifying a module to G10, which is not a complete EHR by itself and lacks an EHR session interface. So in this case, the developer can use software such as Postman to emulate the first step of a user launching an app from an EHR. In this context, the emulation software would not be relied upon software. Another option is the developer could adapt the code from the Inferno reference server to have an EHR user interface from which to launch an app for testing purposes. Next slide, please. And then this is just a picture of the Inferno reference server EHR interface from which a user launches an app as part of the Smart App Launch EHR sequence. So this user interface can be adapted by a health IT developer as part of demonstrating their health IT module supports initiation of the EHR launch sequence. Next slide, please. And this is publication of service-based URLs. So who is responsible for publishing the G10 service-based URLs? The API maintenance of certification requirement at B 174.4 B2 requires a certified API developer to publish the service-based URLs for all health IT modules certified to G10 that can be used by patients to access their electronic health information. This includes publishing the service-based URLs for all of its customers, regardless of whether the Health IT modules certified to G10 are centrally managed by the certified API developer or locally deployed by an API information source. ONC provides discussion regarding certified API developer publication of service-based URLs in the ONC Cures Act final rule, and the ONC Cures Act final rule also provides an example which discusses API information sources, providing certified API developers service-based URLs in the context of information blocking. Next slide, please. And now I will pass to my colleague Keith to discuss the API resource guide.
Thank you, Scott. Thank you, Scott. And yeah, this is Keith Carlson, also in the tools and testing branch. I have one slide here just related to what Scott just went over, because Scott just kind of gave a overview of some of the recent inquiries we've received in our Health IT feedback and inquiry portal related to the our API certification requirements. And I just want to call out that we have recently, in the past few months, also been publishing these inquiries in the API resource guide. So I'll put a link in the chat to these 2 links on the slide here. But you can just, bookmark those pages or look back at those pages to see kind of anonymized versions of the inquiries that we receive in our feedback portal. We wanted to do this because we, find that folks will ask similar questions, or that responses we provide to one person in the portal could be broadly helpful to the community. And so we don't want those to just be scoped to one person who asked it. And so, yeah, please feel free to take a look at that. And, really, when I say anonymized, we really only anonymize the questions that people ask us, because sometimes they, will include some implementation details in their questions. And we certainly don't want to publish that publicly, but our responses are usually, very generalized, and it's not like we're having to edit our responses very much. So if you want to see some examples of the raw responses we're providing to people when we get inquiries related to our API criterion, you can see those at those pages. And we just hope that this will be helpful information to certified API developers, developing to G10 and trying to meet the 17044 for API conditions and maintenance of certification requirements. So we can go to the next slide. Yeah, so this, and then I also want to talk about the most recent version of the G10 test procedure, because if you have not seen it yet, there were kind of a lot of changes to it, and just want to kind of specifically walk through some of the big changes we made. So we can go to the next slide. I'll do a live demonstration, but I have first just a level setting slide on some of the big updates we made to the most recent version of the G10 test procedure, which is version 2.2. This was a big new version because it included new steps to cover standards that are now available through the standards version advancement process that Health IT developers can optionally choose to certify to, can certify to a newer version than what is in regulation via the standards version advancement process. And so just at a high level, some of the overall updates we made to the G10 test procedure in version 2.2 compared to what previous versions had. We added unique IDs to each step. And you'll see an example of this when I do the demonstration, but just to help identify specific steps, and especially when steps are reused across standards, we hope these unique IDs will make that clearer. And then we also grouped steps based on the standards that they're applicable to, because now there are multiple versions of standards available for certification. And so we kind of have these, we have to group steps because sometimes there are some subtle differences between versions, and some subtle things that will be tested differently based off of what version you are selecting. If you see that screenshot on the bottom left-hand part of the screen, that's what it looks like on healthit.gov. We kind of have these accordions, that you can expand based off of a version of a standard. And, you can just kind of pick a standard that you are wanting to certify to and expand the accordion, and you'll see all the steps applicable to that standard. And in some places there are duplicate steps, like for example, in this, screenshot of those 2 options to expand smart version 1.0.0 or Smart 2.0.0. You know, if you go into healthit.gov and expand those, you'll notice that there are a number of steps that are similar between them. And that is where the unique IDs can really help you identify the identical steps, because the IDs will be the same. But then you'll see, you know, in some cases that they're like new steps for Smart version 2, because it includes some different requirements. But basically there are the live demo I want to do here, and I can start sharing my screen because there are 2 places to access the test procedure, and want to just be sure to call that out. So let me go ahead and share my screen. Should be seeing Google Chrome, my Google Chrome with healthit.gov. So if we navigate to the G10 test procedure, you know, which is in our certification of health IT page. G10 is a 2015 edition cures update criterion. So we're at this G10 certification companion guide, which I will put this link. I'll put these links in the chat as I'm going along here. Hopefully most people, especially if you're certifying to G10, are already very familiar with this page. But like I said, we have, you know, this test procedure button up here with our new updated test procedure that includes these expandable accordions based off of what version of the standard you want to certify to. So if you're developing to Smart version 1, you'll expand this and you'll see all the steps applicable to Smart App Launch version 1 to meet this paragraph of the G10 requirements. And then if you optionally want to choose to use the SFAT version, Smart version 2, you can expand that and see here. And yeah, I mean, just one specific thing I want to call out too, you know, you'll see the example of the unique IDs being useful here because, like, for example, OTPAT1, so this specific step applies to both Smart version 1. We can see that we have OTPAT1 listed here. And then if you expand Smart version 2, you see OTPAT1 here. So again, these unique IDs are helpful if you want to compare the steps between different versions. And also just want to call out that, you know, there are unique steps, you know, again, if you've taken a close look at this test procedure before, you'll see some steps, like, for example, this one, OTPAT 10, that kind of includes, you know, a requirement that is a result of overlapping standards, right? Like we have many different FHIR implementation guides we've pulled into the G10 standardized API for patient population services. And so this also includes, you know, based off of different US core versions, you'll need to support different scopes. And so you just want to read closely for, like, if you're going to use US core 5, you also are required to use, you know, support these additional resource scopes. And so just things to look closely for in this new test procedure on healthit.gov. But the other thing I want to call out quickly is that on this CCG, in both of these tabs, I want to be sure folks are aware of this resource documents dropdown up here, because we have a link to the API resource guide here, which I would encourage folks to also take a look at for more information. I'll paste a link to this API resource guide in the chat. And specifically to the test procedure, let me zoom this back out, you know, because I just showed that we have the test procedure available here with these accordions, but we also have another version of the test procedure. It's the same content, just presented in a different way on the API resource guide. I'm going to go to the G10 page, and in the table of contents, this is under the test procedure anchor right here, which I'll paste a link to the specific anchor in the chat. It's the last link I'll put in, but you know, you can also view the test procedure here. If you want just to, instead of having to kind of expand accordions, right? Like you have to, you know, there are multiple accordions you'd have to expand in this version based off of what standards you're wanting to use. With this one, we provide kind of a form where you can just upfront select the standards you want to see a test procedure for, and then click view test procedure, and that'll take you to a page that's we hope a little bit cleaner and just contains all the information in one place without the need to expand or collapse accordions. So it's the same information, just in a different format that we just are trying to make it as easy as possible to view all of this information. And just a couple points with the API resource guide specifically is up here on the top right. You can go to the GitHub repository that this resource guide is built off of. Encourage people to take a look at that, and really kind of this API resource guide is our first attempt to try and improve some of the ways this information is presented to you all, especially the really technical information. And this is a process we're going to be continuing to work on a lot. And so please, we encourage feedback. You can submit feedback in the GitHub repository, post an issue if there's something that's challenging you here. Right now in the chat on this webinar, if you have any suggestions for how we can better present this information and make it more usable, we'd love to hear that. But this is going to be an ongoing process that will continue to solicit feedback on and just continually encourage feedback from you all. So with that, we can go back to sharing the slides, and I believe I'm turning it over to Johnny Bender. So thank you all.
Perfect. We can go to the next slide. We'll try and quickly walk through this. We had the Inferno framework released in the spring 2022, which I'm sure most folks are aware of. We did this to improve a number of provide a number of underlying enhancements to Inferno, including the backend architecture. We defined a Ruby domain-specific language that can be used to sort of write tests for Inferno. And we did this with the aim of making it easier for developers to sort of create their own tests. And I'll go into some more details that are listed on this slide in a bit. But sort of the Inferno framework essentially includes two big pieces. One of them is Inferno core. So these are sort of all of the functionalities that Inferno needs to interpret the domain-specific language and actually execute tests, which is like the test runners, and then also other pieces like the user interface and stuff that we'll see in a bit. And then also, in addition to Inferno core, there's test kits, which are actually sort of the buckets that are used to define the tests for certain use cases, be it an implementation guide like US Core or the Smart App Launch Framework, or for a certain use case like the G10 standardized API criterion. We can go to the next slide. And so with the Inferno framework, this new release, now you can use this domain-specific language that we've defined within the Inferno framework to write tests for Fire and sort of Fire-related implementation guides. And so what would have been complicated interactions and assertions are simplified to a few lines of code. So we're trying to basically make it easier for folks to write and maintain tests in a flexible development environment that is sort of Ruby native, so it can be extended as needed. So, for example, if one were to perform a read request on a Fire API, make sure that the read request is successful. You want to make sure that it's returns a Fire patient resource and that it's valid according to the HL7 validator. This would typically take quite a bit of code to write. But in the Inferno framework Ruby domain specific language, we basically have a sort of a one-to-one line mapping here. So we have this Fire_read operation, which executes a read request at an endpoint that's defined further up in the code. And you say the resource that you're attempting to read and the ID. There's also additional parameters you can throw into here. And then once you get this response, you can perform assertions on that response. So we've asserted the response status is at 200, which is successful. Assert that the resource type is a patient, and assert valid resource performs a validation check for the return resource on the using the HL7 validator. So this kind of shows how powerful Inferno can be to support testing use cases. So in a few lines of code, you can get some testing started. So we can go to the next slide. Additionally, Inferno, the new Inferno framework has a first class JSON API. So in the past, you sort of had to interact with Inferno via the web user interface or a command line interface. And with this next new version that we released in the spring, we've defined a first class JSON API, which is actually used in the instance of Inferno that's hosted on healthit.gov. And you can basically just execute tests via the API or, interrogate the instance of Inferno that's running for the test suites that are available in that instance of Inferno. And you can provide inputs and get outputs via the API as well. So it's quite powerful and is also available in addition to our Ruby domain-specific language on the Inferno framework documentation. You can go to the next slide. In addition, so now that we have the first-class JSON API, we've sort of separated out the web user interface, and this is all written in React. And this it ships with Inferno Core and is generated based on the content that's included in a test kit that interacts with Inferno Core. So you can see I've sort of customized a test suite here, which is contained in test kits to include my information here. This is my test suite, and you can define groups and provide descriptions for the test suites. And if you can go to the next slide, you can even customize, with literally just one line of code. The operation is input. You can get basically this capability for users to provide inputs via the web interface for different tests. So you can have inputs for these tests that are then used in the tests. They're accessible and used inside of the tests. And then those tests can also generate outputs, which can be used in other tests or sort of rendered in the user interface here. So encourage folks to take a look if you haven't dove into sort of the Inferno framework documentation. Encourage folks to take a look at sort of the powerful capabilities that we have available. We can go to the next slide. And so sort of just quickly, how can Inferno be useful? So we're sort of examining this ourselves and talking with folks in the industry about this, but a brief list here. One use case is like writing and testing a systems conformance to an implementation guide. There's several examples of this, but including like IPS/IPA implementation guides. The Tacoma MITRE project is working on the data exchange for quality measures implementation guide, all in Inferno. You can also write and test a systems conformance to a use case that combines implementation guides. So due to the nature of Inferno framework, you're able to sort of incorporate test kits that you define or test suites within those into other test kits. So you can sort of import these together. So what we've done this with the G10 standardized API test kit that I'm sure most are familiar with for the G10 criterion, and we've incorporated the test kits for like US Core, Smart App Launch Framework. We have the TLS kits. Test kits, etc., into this one test kit for our specific use case. And then you can also use the testing to monitor interfaces and data. So there's several vendors that use the Inferno framework JSON API as part of a continuous integration process, where if you make updates to your API, the sort of new API and the changes are then tested to ensure that it's still operational with the updates. That's a clear use case that we see. Additionally, you can one use case we're trying to pursue as well is you can use testing to improve an implementation guide or provide clarity for implementations. So we have since we required like the US Core implementation guide as part of the Cures Act final rule in 2020, we've been sort of working over the past almost 3 years on updates to the implementation guide, discovering a lot of the issues through testing and implementation. And then also we're sort of working with a number of folks in the industry on brainstorming and figuring out ways that we can facilitate sort of authoring testing artifacts as part of the IG publishing process. We see that as a very nice way of providing clarifications on the capabilities that tools are supposed to support when they actually go to implement, or systems are supposed to support when they go to implement implementation guides. How Inferno can be useful. Next slide. And so at this point, we are working on sort of a strategy for Inferno Framework in the future. We've been conducting interviews with lots of folks in the industry and also doing our own analysis of sort of the health IT landscape. So we've interviewed with like 23 organizations and sort of investigate if and how they use Inferno, get some initial feedback, and then try and understand their thoughts on the future utility of Inferno Framework. We don't have sort of the same market forces that like private industry has when publishing tooling. And so we really rely on feedback from the industry on what would be useful so that we can direct our development activities. So we actually build things that are going to be used. So it's very important, and sort of trying to stress how much we want to hear feedback from folks in the industry, including all of you on the call, about how Inferno could be useful to you, and sort of have an outline here for some of our strategic plan development, our vision, values, and goals. I'm not going to go into too much detail just because of our time right now, so we can go to the next slide. But these slides are also available after this presentation. And so I guess sort of would like to ask how Inferno can be helpful to you. So not a lot of time here for sort of live feedback, but definitely encourage feedback via the Inferno channel on Zulip. If you find any enhancements, feel free to log them in GitHub issues for any of the relevant GitHub repositories. You can also email myself or any of us in the tools and testing branch or certification division. It'll sort of get to us. And our emails are pretty guessable, first name, last name @hhs.gov. And we're sort of seeking feedback like, what's your experience been with Inferno? What's worked well? What needs improvement? How could, Inferno be improved in the future or positioned to help you or your company better achieve its goals? How can Inferno help move the needle in health interoperability? And then how can we sort of, foster a community of contributors to Inferno Framework, right? For developing test kits for different use cases, and then even potentially contributing to Inferno core. And what we've heard so far, we've heard quite a bit of feedback. But there are things like error messages could use more clarity. We've gotten a lot of positive feedback for the level of engagement that MITRE provides in the community forums. Requests for certain domains of like test kits, so like payer-related test kits would be helpful. Requests for like more sharing of user-created test kits and test suites inside of Inferno, documentation improvements, stuff like this. So again, if you get these slides afterwards and you're interested in providing feedback, we'd love any feedback along these lines. So we can go to the next slide. And just a listing here too, again, not going to go too much into detail, but these are sort of the focus areas that we've established as part of this strategic plan and hearing feedback from the industry. We have certification program, sort of Inferno core, and then supporting communities to contribute libraries, our sort of stewarded testing artifacts, the focus on standards and implementation guide development and support in that regard, and then sort of Inferno framework governance and operations overall. So that's just FYI there. We can go to the next slide, which I believe is, yep, this is just a list of resources that are available. Hopefully they're helpful when you download these slides. And with that, I believe we're done with the slides, and I can hand it back over to Sean to close this out.
All right, thank you, Johnny, and to all of our speakers today. We are about at time, so please, if you have any follow-up questions or anything regarding the certification program, please feel free to submit to our JIRA inquiry portal, which is linked at the end of the slide. We will be distributing the slides as well as a recording of this presentation. So with that, please enjoy the rest of your day, and thank you for attending.
Thanks, Phil.